Okay, hi, I'm Monica, and I'm going to talk about the history of transference and transparency. So transference was first described by Freud in 1895. It is a form of projection. So the client will have feelings and desires towards the therapist that stem from earlier attitudes towards important figures in the client's life, such as their mother or father. It is an unconscious process and has an important role in psychotherapy. It can help identify conflicts in the client's life and help to resolve them. It occurs in both individual therapy and group therapy. In the beginning, Freud emphasized the importance of the therapist remaining a mirror to the client. So that means reflecting nothing but what is shown to him. The therapist's role was to make rational interpretations of what was presented to him. Self-disclosure would cross that boundary between a therapeutic relationship and a personal one. However, Sander Ferenczi felt differently about this. He felt that a mutually honest and transparent relationship between the client and therapist could be a mutative force in therapy. Therapist self-disclosure, when used appropriately, can now be therapeutic in nature and can help clients feel supported. It also helps clients explore deeper into themselves. Self-help groups such as 12-step programs rely on mutual self-disclosure for support. It's also used in individual and group therapy. I've had experiences in clinical where clients can be standoffish for no reason, and when you actually confront the person about it, it's usually because you remind them of someone who they've had negative experiences with in the past. And you can just help them explore their feelings and how to work to resolve them. There's also been times when I self-disclose, but I find there's a fine line between disclosing too much and making it about yourself. I find it only helpful to use transparency when it's helpful in helping the client explore deeper into themselves.
I'm Sheena, and I'm going to discuss why mastery of transference is essential for a nurse when she's working in a group setting in regards to the therapist. The reason mastery of transference and transparency is essential for any nurse working with clients in a group setting in regards to the therapist is essential due to awareness. Oftentimes, it is common for clients to transfer their past emotions onto their therapist, and it can be that some therapists may not even be aware of this themselves. Therefore, as a nurse and undoubtedly the co-therapist, or as even someone who is observing from an unbiased place, it is our job to recognize and be aware of such events. When being aware of this phenomenon, we are in a place where we can change the course of the therapy in the event if it appears to be leading towards an unhealthy and unsuccessful direction. For example, during a group therapy session in one of my past placements in acute psych, one client started to transfer her negative feelings from her father to the mental health care worker that was facilitating the group. This mental health care worker was a male. This became very detrimental for the client's mental health being. Although this particular therapist became aware of this early on, there is no question in my mind that this would have ended unfavorable for both the therapist and the client themselves had they not been aware of such.
Okay, hi, I'm Gina. I'm going to talk about how transference benefits the patient. So transference can be perceived as the emotions and feelings from clients from past that has been shifted towards the current relationship with the therapist. Transference has a positive effect as it makes patients aware of what is real and what is fantasy during therapy. It is beneficial as patients begin to recognize these situations as dangerous because they remind them of past dangers. Through transference, patients gain a better understanding of their repressed emotions and become aware of their deep-rooted feelings and attitudes towards past relationships. They are able to distinguish the associations they are projecting towards new relationships. Exposing these issues will eliminate interpersonal problems or relationships and make the client more self-aware. So for instance, if the patient views the therapist as a maternal figure after they've had a traumatic experience with their own mother, but can't move past and separate the therapist from the mother, it'll stunt their relationship and not allow for any further progress. If they do move past, then the patient gains a chance to work out their projected feelings. Okay, hi, I'm Jasmine, and I will discuss exactly what these guys discussed, but how it could possibly result in positive or negative circumstances depending on the situation and whether or not transference or transparency is present. Guillaume suggests that transference can either be an effective therapeutic tool or a set of shackles that encumbers your every movement. So this means that either you're going to be able to work through the feelings, like Gina just stated, or you're going to be stuck in one position where neither person can move forward, despite what the therapist might try. And eventually, I've noticed that transference, a lot of times the therapist won't be able to move past it either, because it's gotten to a point where it's just so strong that you're not allowed to really being able to get anything else in. At the beginning of the relationship, though, it's important that the therapist be a blank slate in order to facilitate any development. If they come into the relationship with their own expectations of the client or their own perceptions of what they might be like and what they're dealing with, it could also possibly stunt the relationship, because now they're going to be biased on everything that the patient is saying to them. In regards to transparency in the relationship, an example that I can think of during my own clinical this semester, there was a young girl who came in and she was speaking about issues that she's dealt with regarding abuse in past relationships, and just having been through a rough time with somebody that she cared a lot about. And during this instance, she kept saying to me that you wouldn't understand, you wouldn't understand. So at this point, I thought it would be okay to self-disclose, and I did share a personal experience with her. And after that, I found that she opened up to me a lot. I had to still be pretty careful about what I did or didn't say, because if I said that something was bothering me or that something at that time had bothered me, it kind of intensified her own emotions as to, yeah, you're right, like this sucked so bad. But if I said, you know, this is how I learned to move past it, or this is how I put it behind me, she began to think more of like ways she could do the same thing. Also, Yellow, the textbook that we're reading, goes into greater detail about possible causes of transference. Transference among group members and therapists could result from the group's desire to want to be the therapist's favorite person. So they're going to share more, they're going to self-disclose more, and they're going to feel like they have a special relationship, so often they'll take control of the group. And this doesn't allow anyone else to have a chance to self-disclose. And it also, the feelings that this person who's taking control of the group is putting forth, so whatever transference the other group members are feeling could also either result in positive or negative. If the therapist decides to focus on that single person, the rest of the group is going to get negative transference, and that can also cause a problem. An example that was presented in our textbook was one where female incest survivors teamed up against the therapist because they felt that he couldn't understand and he was a pervert and he was just trying to take control of the group. And here, the transference worked in a negative way because all of the group members basically just teamed up on him, and there was no moving past that. The group wouldn't be able to work out. An example of a situation of group transference that I've dealt with, again, during this clinical rotation, it wasn't a SAC group, like it wasn't prepared for therapy. It was just a group of people who generally were together and they were sitting together, so I was sitting with them. And one person was talking about how he didn't want to go to recovery because he felt that he wouldn't manage anyway, and he thought he was going to fail, it wasn't going to work out for him, and he was just being really negative and down on himself. This brought in another person who was also looking at getting into recovery, and both of their feelings, they just intensified off of each other. They transferred their own feelings to one another, and they were both really just down and out on it. The rest of the group members who were available, they began talking about positive experiences that they've had, or, because it started off with them trying to make the other two feel better, like, no, you can do this. But it ended with them sharing accomplishments that they've had and, happy experiences despite whatever else has happened in their lives or what situation they're at. And eventually it got the two who were being negative and not very happy with the situation to start talking about whatever accomplishments they had. It resulted in the guy deciding to give recovery a chance, and it just showed how transference can be positive as well. But yeah, there you go. Okay. Any questions, guys?
Yeah, I have a question for Gina. So how does the presence of transference and transparency affect the behavior of the therapist or the group?
It affects it by because either you can help develop the relationship, or it'll help, or it'll hinder the progress of the relationship between the patient and the therapist. If the patient gets a chance to reenact and reflect on previous situations and learn from these experiences, they'll be able to deal with past repressed emotions. But if they can't move forward with transference, it stunts the relationship and they won't be able to move forward.
I have a question for Monica. You guys all touched on how transparency can be beneficial, but in what cases do you believe that it can be more beneficial than harmful?
When used appropriately, transparency can be quite beneficial. It just makes the therapist and the procedure more relatable to the client. So it helps engage the client more authentically. It also acts as a form of validation for clients, so they don't feel so alone in their experiences. Transparency can also help develop other therapeutic factors such as imitative behavior, interpersonal learning, and group cohesiveness. When a therapist discloses how they feel in the moment, they can help activate the here and now process, which helps bring more self-awareness to individuals in the group.